Today we're talking about multi-generational homes and safety in a global pandemic. Our subject matter expert is Xiomara Hewitt, who serves as AdventHealth's Corporate Director of Infection Prevention. Xiomara, you're a specialist in infection control. You have a master's in public health.
That's correct. I'm very blessed to be part of a team that focuses on the infection prevention strategies, not only within our facilities, but also to help our communities to keep themselves safe at any time, but especially now so crucial during the COVID-19 pandemic.
So let me ask you, why are multi-generational homes facing a special set of considerations regarding safety?
Yes. In many cultures, it's not uncommon for you to have family members spanning over different generations and different age groups to be living in one household.
Right.
Because of the virus being transmitted from person to person through the respiratory droplets that are generated through coughing, sneezing, talking, breathing, and in the situation of a multi-generational home or extended family household, you have a very small space, increasing the risk. In addition, we do, from the data that we continue to receive from the Department of Human Health Services and the Centers for Disease and Control and Prevention, we know that unfortunately COVID-19 has had a disproportionate impact on some racial and ethnic minority groups. So we have to be really keeping that in mind, because it is not uncommon to see in ethnic minority groups for family members to be living in multi-generational homes.
The beautiful thing about a multi-generational home is the warmth of relationships that exists between certain generations, especially between children and their grandparents.
Absolutely.
So what should children do? What should grandparents do? A child comes home from school and they see grandma, they see grandpa there. Should they feel like, oh no, I have to stay away, or are there some precautions that they can take?
Oh, absolutely. We don't want to take away from that aspect of that richness of sharing the love and the affection to one another. We just need to think about some other ways that we can still show the love through different ways of interacting with each other. A different handshake. My son likes to do the elbow bump, and it's very important for us to still feel connected, especially when we have the multi-generational homes. Sharing activities that, if possible, maybe can be done outside. While the data has shown that indeed that the incidence of the illness has not been as high in young children compared to older adults, we want to also remind our community that while they may not be vulnerable, they can put vulnerable people in their household at risk because they can bring the virus into the household. We need to model the good behavior to our children, to our young children, especially in the situation that you mentioned when you have children coming in from school. So again, helping them, modeling for them to remove your shoes, change your clothes, wash your hands. And then now we can go ahead and interact with grandma or grandpa.
So we've been working very hard to keep everyone safe, but there are times when it's inevitable and someone does get sick with COVID-19. How do we keep the rest of the family safe?
Yes. When somebody in the household becomes sick with COVID-19, what it is recommended is for the person to stay in one room and limit the physical contact with other members of the household to reduce the chances of transmission. Also, if all possible, for the person to use a specific bathroom. Now, we know that at times that all these strategies may not be possible, so the household needs to be then very conscientious about cleaning surfaces, cleaning the bathroom more frequently especially after the sick person uses the bathroom. And if you have to be in the same space, in the same room, trying to maintain 6 feet of physical distance and wearing a mask. That would then reduce the risk. We also want to make sure that you think about designated one person who will be taking care of the person who unfortunately became sick. It's not that we don't want for other family members to interact with them. Thinking about how can you still connect with that person is very important by the usage of doing video conferencing. I know it may sound funny, doing video conferencing from one room to the other room, because we still want the person to feel connected and that they're still part of the family, even though they're physically isolated. We want to make sure that they still feel that they're part of the family, because that's very important for their recovery.
So we've shared a lot of information today about how to remain safe, which could make someone feel a little anxious and a little worried about being in a multi-generational home environment. But what's the bottom line about both the benefits and the tips to keep in mind when it comes to living in a multi-generational setting in COVID-19?
Multi-generational homes are filled and rich with love. We cannot let the pandemic change that. We may have to do things a little bit differently, but I encourage everyone to still continue to take care of themselves and each other, and that's how we're going to get through this.